welcome to Mac Business Channel. And as usual, we are here with you, and we'll be discussing in this show about the great rishis of and to discuss about today's rishi. I think you will be more pleased, and you will be able to really know about a great rishi by the name of Sushrit. And he is considered as the father of surgery. And to tell you more, that he was son of a great rishi Vishwamitra, which we have discussed earlier. Now, Sushrit is also of Sushrita Samhita, in which describes about 300 surgical procedures, 150 surgical instrument, including lancets, needles, catheters, and there are so many instruments he designed from the jaws of animals and birds. So, and that too a very long time ago. And he and scientists of the time conducted complicated surgeries like cesarean, cataract, artificial limb transplants, and rhinoplasty. And a part of this, 12 types of fractures, six types of dislocation and urinary stone, and plastic surgery, and of course, brain surgery. So please stay in this episode, and we will be telling you more about the father of surgery, Rishi Sushrit. So before we start telling you about Sushrit, it is very important to tell you about the sage Vishwamitra, because Vishwamitra, great Vishwamitra, father of Sushrit, and he is one of the most prominent and most influential rishi of India. According to Hindu tradition, started stated like he has written the third mandala in the Rig Veda, which in Gayatri mantra, and that is why he is being remembered, because he has done that kind of research on Gayatri mantra. The Purana mentioned only 24 rishis from the antiquity who have understood the whole meaning of Gayatri mantra, and Vishwamitra is one of the first. Actually, not one of the, but he is the first rishi to understand the Gayatri mantra and make other people understand. A part of this, as you know, that Vishwamitra was from where he left his kingdom. He was from a royal status, and that's why he is called Raj Rishi, or a royal sage. So that's makes very unique rishis when actually we talk about rishi. And also placed in Saptarishi title. You also have the now Vishwamitra and Vashishta has a long-standing conflict, and we have also done a series of 10 king of war, which was initiated by this conflict of Vishwamitra and Vashishta. So that is also makes Vishwamitra very important, especially when we discuss his style and his aura. A part of this, he credited of creating Shimpu Swarga, which is heaven away from the heaven, and that's why he is popular. And he was also a teacher to great Ram, and his name is mentioned in epic Ramayana. So that is very much important. Really, before we discuss the Shrushit and the all Kaushikas and Vishwamitra Gotra people really claim themselves that they are descendant of sage Vishwamitra. Now let's talk about the Sushrit Samhita, and Sushrit Samhita, which is written by Sushrit, and which is a manual for the patient. And historically, diseases described was caused by the imbalance of the body, and if the physician is taking care of any patient, it is his duty to maintain balance and restore it if it has been lost. So, to this end, everybody has emerged, talk about this and practice medicine, and the main aspect of Samhita and the Sushrit teaching is creating balance in the body, and describe the ideal medical practitioner focus on nurse. As it is stated in Sushrit, I said the person who alone to work as a nurse and to attend the bedside of the patient should be very cool-hearted, and he should have a pleasant manners and does not speak ill about everybody, and is strong and attractive, and that is kind of person is required to become a nurse, and strictly and without losing cool or without getting tired. Sorry, without getting tired, he should take care of the patient. So these are the highlights of few highlights of Sushrit Samhita, and Sushrit Samhita also describe in a great length about the reconstruction of nose and call it rhinoplasty, and that the kind of skin that which was taken from the forehead of the patient, and it was used to place for the and used as a reconstruction of the nose by Sushrit, elaborately mentioned in Sushrit Samhita. And you know, in olden times, the nose is amputated as a punishment to the crime, and the technique practice almost unchanged till today. And the all this and the flap which we take, the skin flap which we take from the head is still called as Indian flap. Now, as I was telling you that Sushrit is the father of surgery in the world, because there are many techniques being practiced by medical practitioners which have the origin in antiquity. If the history of science is traced back the origin, I think there are many aspects of medical, especially surgery, which is being taken by Sushrit Samhita. And when we talk about Sushrit and how he has placed these techniques, so I would like to tell you that the surgery into 8 heads. One is Chidya, which is we cut it excretions, then Lekhya, which is sacrification, and then Vidya, which is puncturing, Asya, which is exploration of the body, Aharya, which is extraction, and then Vasya, which is evacuation, and Vya, which is kind shuttering or taking few things out. All these basic principle of surgery and which planning and precision, which is all being described by book. So when we discuss about and this kind of contribution done, and we in all basic surgery planned and we created by his disciple, and which is in Sushrit Samhita. Now let's talk about surgery instrument, and you know that is also a big contribution to Sushrit in medical science, because he worked or he compiled uh, Samhita, and he described the 60 types of upkarma, that is for the treatment of wound, and 120 type of surgical instrument, and 100 types of surgical procedures, and the classification of human surgeries in 8 types. So this is our ultimate contribution when we talk about the surgeries of human body. To Sushrit, health was not only a state of physical well-being, but also a mental calmness. And then when we maintain these balance through your personality, your good nutrition, proper elimination of waste from the body, and the then pleasant content state of body and mind, that is described and stated by Sushit as a person, and he is also written Sushit Sanghita. For successful surgery, Sushit introduced also mentioned that anesthesia usage, and in older time the toxicants such as wine and cannabis indica were used, and he treated numerous cases of rhinoplasty and on other types of surgery in his time. The rhinoplasty described by Sushil is referred as I was telling you, Indian flap, and the whole procedure is. He describes six varieties of accidental injuries and of the body, and these are described like this, like chinna, which is uh, severeness of the part of the limb, the body. Then bhinna, which is a deep injury to some hollow region of a long piercing object. Then vidha prana, which is puncturing a structure without a hollow. Then kachta, which is uneven injuries of both chinna and bhinna. And then pichita. Pichita is crushed injury due to fall or a blow. And then grishta. Grishta means superficial injury on the skin. So all this is mentioned in Shushita Samhita, and beside trauma involving general surgery also give and account and description of treatment of 12 variety of fracture type of dislocation, and this continues spellbound orthopedic surgeon even today. Mentioned the principle of traction, manipulation, and opposition stabilization and prospective post-operative, I mean, a physiotherapy. He also mentioned and described measure to growth of lost hair and the removal of unwanted hair. Implored surgeons perfect healing with characterizing our absence of elevation, swelling mass, and return to normal coloring of hairs. So this is what is mentioned, and this makes Turshit one of the very profound rishi from Antony. Let's discuss about the Ayurveda, and there are many Samhita and many Granth which deals with Ayurveda, and one of this which is being followed in Ayurveda is Charak Samhita and Ashtanga Sangrah, along with the Kushit Samhita. These are the main three pillars of Ayurveda, and in Charak Samhita and Ashtanga Samhita mainly medical knowledge, and as we were discussing, Samhita, which is like knowledge, and we all form surgeries like cesarean, cataract, and artificial limb transplant, fracture, urinary stone, and plastic surgery. I already discussed. This is quite a profound knowledge which is flowing from the antiquity, especially from Indian way of life and Indian culture. The Ayurveda medicine is among the oldest medicine in the world, dating back to time, and this translate the Ayurveda itself means the life knowledge or the science, and practice holistic. Not only India but many people around the world are are following this art of living through art of living. So now, when we talk about he also described a very profound description of medical practice. And when we talk about practitioners, and he mentioned in book that the plastic surgery, the dental surgery, which not only practiced today, but it was also practiced in India, and how he really trained his student. That is also a very profound and very interesting aspect of Sushruta teaching. And he said, are probably training who comes as a trainer to Sushruta. So new student work at least years with Sushit, and in his school and character training. And before beginning of the training, they used to take an oath of in modern times, the doctors take an oath good things for the patient. They will devote themselves in society, for society, and work for the patient, and will not look into their own comfort, but look at the patient's comfort. These kind of oaths were there, and every student had to take these oath. And then they were taught surgical skills on various experimental models, like there are insertions on vegetable and watermelon, cucumber, and probing warm eaten wood. That is also part of their training, present day workshop. That which even if you the present day workshop, they also somehow somewhere start with that. But this kind of training was done 2 years back, and all these were experimental teaching. Once the student is well versed with kind of holding them and how to do insertion, what type of surgery is what he's looking at, then he will pass time will be getting a human body, or that body learn about the organs and all human procedure on a dead body. So I would like to really mention a little case study of rhinoplasty video, which is being mentioned in the Samhita, and it is like this. The practice was almost established at the time, and especially the rhinoplasty, and there is a lot of in-depth knowledge was there in the reconstruction of nose, and the process used to be that the one portion covered should be covered first with the leaf of the size of the nose. Then a piece of skin is required accordingly the size they have which they have already taken, and should then dissect it from the cheek, the other part of the, and then it was turned into those small attachment which was fixed on the cheek, and then the one part of the nose to which the skin is attached should draw by cutting the stems with the knife. Then the physician would place the skin on the nose, stitch of the two parts swiftly, and keep the skin properly elevated by inserting two of castor oil plant, I mean small branches, in the position of nostril, so that the new nose get proper shape. The skin thus properly adjusted, and it should then be sprinkled the powder of liquor and red sandalwood and barberry plants. Finally, it's covered with cotton and clean sesame oil constantly applied on that area. When the nose, when the skin actually has united and granulated, if the nose is too short or too long, then instead of the added with a process may enlarge or shorten it. So this is what this process is being mentioned in the Sushit Samhita, and uh, many part of this whole process even today is followed. And the wine was used as anesthesia, and the patient were encouraged to drink heavily before the procedure. When the patients were drunk to a point of insensibility, then he and she will tie to a low-lying wood table to prevent the movement, and the operation begin. Surgeon sitting on the stool and tools on nearby table, something like a modern operation theater. The use of wine led to development anesthetic involvement, both alcoholic and cannabis, and there are instances are used time to time if the patient is coming and the sentences they are being again given, and this is the way of rhinoplasty being mentioned in this Sushruta Samhita. So this is a very good contribution, because in those days the tradition of giving punishment were like that cut noses of women and men. So, and it really was very social stigma for people who go through this kind of punishment, and and even they are not able to really live in the society. And sometimes it that the people were not guilty, but even then they were the nose were amputated by this punishment. This this is a great contribution, because really remove the stigma which these people used to live for their rest of life, and that created a hope and normalcy in their life. So this is what we wanted to discuss about Shruti. A great contribution of this, and time has come to really acknowledge and may give more respect to Rishi for his contribution. All is known about him, that the practice he has done. He used to do practice in North India. It is said around the Varanasi, modern Banaras, by the bank of Ganga river, and he was regarded as a great healer and a sage which is gifted by these things among all people. And that's why there are so many legends which is associated with this uh, great Rishi, because it is said that Dhanvantri himself passed on ideas and surgery to Shrit. So, but all this is a legend, but this Rishi really had a knowledge and contributed immensely when we talk about the medical science. The science of medicine is actually incomplete when we talk about the antiquity written documents, and there are many thousand who are being followed even today. The, the Ayurveda, so there are a lot of medical which we believe and we practice. Shushit always say that in his writing, he said the science comprehensive as ocean. It can describe even in hundred and thousand verses. Tell people who are incapable of catching the real importance of reasoning would fail to really acquire a proper of this science, medical science, with many verses, but still there are many things is left, and that comes only with the practice. The occult principle of medicine, as explained by the sage, it also says that you should believe in that, and gradually this will grow and sprout in a good way of medical science, and that will make every individual, every doctor a genius, a medical genius, and that is stated by Shurshid in. So this is what I wanted to convey to you about the contribution, or to tell you the contribution of Shurshid in our lives, even in modern times. And we'll be meeting again and discuss more profound rishis in future episodes. Till then, enjoy and take care of yourself. Bye.